So, hello, my name is Sarah. I'm a physiotherapist and I'm going to be running today's Pilates class. And just for the video's purposes, I don't have a proper clinical setup. So normally I would present at the front of the class with my own mat, going through the exercises with everyone kind of in front of me with their own mats so that I can actually see them, but I just don't have access to a clinical space at the moment to be able to do that. Okay, so I understand all you ladies are relatively new post-op for your breast cancers. So the key thing is don't push into pain with any of the exercises. A little bit of discomfort, feeling a stretch, that's absolutely fine, but it's far better to go a little bit easier on the exercises and just gently build up than pushing into pain, because it will just cause more inflammation and make it more sore. And then the other thing is, if you are struggling with anything, you've got any niggles or something is unusually painful, raise your hand, let me know, and I'll come over and help. Okay? Lovely. So first of all, we're going to stand at the top end of our mats, and we're just going to find our midline position first of all. So move your feet in and out and just find that middle position that feels comfortable for you, and it should be somewhere around about hip width apart. And then in this position, just think about your knees for a second, bend and straighten them, and find that position where they're not fully locked out, but they're in extension. And then put your hands on your hips. And we're just going to do a couple of what we call pelvic tilts. So in this position, imagine your hips are a bucket of water, and we're going to rock our hips forwards, spilling water out the front, and then squeeze your bum and rock your hips back and pour water out the back. And just do 3 to 5 in this position. And once you've done your 3 to 5, find that middle position where the water isn't quite spilling out the front, it isn't spilling out the back, it feels nice and level. Good. And then just relax your arms by your side. Imagine you've got an orange between your chin and your chest. We're lengthening our shoulders away from our ears. And then just think about where your ears, shoulder, hip and ankle position are. Are they on top of each other like a vertical line? And then just place your hand on your stomach. We're going to do 5 deep breaths. So what we're going to do is as we inhale, we're going to inhale through our nose and feel your stomach expand into your hand. And then as you exhale, I want you to lightly draw your belly in towards your stomach. So inhale through your nose, exhale through your mouth. Inhale through your nose, exhale through your mouth. And keep going for me. And the reason we're getting you to do this exercise is it helps with circulation, but it also helps with lymphatic flow. So it's really, really useful to get everything warmed up and to prime our major muscles for posture. Lovely. Brilliant. And then we can relax ourselves down. And then we're just going to warm up our shoulders. So we're just going to swing our shoulders around our body. There's no perfect technique here. We're just loosening things off. Keep your hips facing forwards. And then think about your rotation of your mid-back whilst you're doing this. Can we get more of a twist through that mid-back? Can we look over our shoulders? Brilliant. Really, really good. Nice. Lovely. And now we're going to step this up into what we call arm swings across the body. So now we're going to take our feet a little bit wider, and we're going to swing and reach, and then swing and reach. Lovely. So again, we're not going into pain. We're reaching as far as you feel comfortable, which for some might not be very far at all on your affected side. And if you feel able, can we reach and do a full circle? Reach and do a full circle. Lovely. Really good, Chloe. Good. And you may find one arm can do the full circle and the other arm can't. And again, think about what your body's doing. We're trying to really stretch out that shoulder joint and get it working. Lovely. 2 more. Lovely. Really, really good. And then lastly, a couple more to go in this position. We're now going to take our arms up overhead. Now again, if one shoulder's tighter than the other, don't worry about pushing it too far. We're going to take our arms up as far as you feel comfortable, which might just be to halfway, and back down. Now, if taking your arm up overhead feels too tricky, what I want you to do is put your arms on your shoulders, and we'll just do shoulder rolls and almost draw with your elbows to get those circles. But for those of you that feel able, Reach up nice and tall and back down. And think about stretching up towards the ceiling and back down. Whilst you're doing this movement, think about what your rib cage is doing. Are you arching your back to achieve that movement, or are you stretching purely from the shoulder joint? Good, we're going to keep going.
So we'll keep the ribs down.
Yes. Yes, so the goal here is we're stretching purely from the shoulder joint, not arching our back. Lovely. Good. Good. Couple more there. Brilliant. And now we're going to go on to what we call a dumb waiter, which is just starting to activate our shoulder blade muscles. So in this position, arms by your sides, palms facing the ceiling, we're going to draw our shoulder blades together and squeeze our shoulders apart. And it's not so much about the distance that your arms move, it's about drawing those shoulders together. And again, making sure that your shoulders are away from your ears. Good. And for those that feel like this is nice and easy, we'll step it up a notch. And we're going to rotate out to the side and then slide up towards the ceiling like we're holding a plate to the gods, and back down and in. So squeeze, up, back down. And you may find that your affected arm doesn't go as far. That's absolutely fine. You just go to the point of comfort and a slight pull, but not pain. And again, think about your chest, think about your ribs, pulling your belly button in so that it's purely a shoulder movement. Good, we'll do a few more. Well done. Lovely. And then the last thing I'm going to get us to do in standing is just to make sure we've got the whole body active. So we're going to do what we call heel raises. So if you need, you can always find a wall, hold on to a wall, but the goal here is to add a bit of balance in. So imagine our pinky of our toes, so the ball of our joints, are our kind of center crux, it's where we pivot from. We're going to push through our big toe and go up towards the balls of our feet and then back down. So it's a controlled movement, push through our toes and back down. And you may find that your ankles want to pull apart. That's perfectly normal. Really try and push through that big toe to help prevent those ankles rolling out to the side. And we're going to do a few of these. Good, really, really good. So pushing through the balls of your feet, lovely, and back down. Nice, being the perfect pupil. Good, good. 3 more. Good. 1 more. And then lastly, just to make it more challenging, we're going to bend one leg. And now we're just going to alternate between the two. And again, this is more to help with our lymphatic system and our circulation. We're just getting some blood flow, some oxygen to pump to every part of the body. We've done a lot for the arms and a lot for the back. Just getting those legs primed before the other exercises. Good. Feel all right?
Yeah.
Good.
I'm dancing.
Lovely. So now we're going to make our way onto the floor, and it's all about making sure you get onto the floor safely. So if you need, you can always make sure we can get something for you to hold on to get down. But we're going to go down onto one leg, bring the other leg to follow, and then we go onto the side of our hips, and then onto your backs.
Right now?
Yeah, on the backs. So in this position, I'll stand up to explain what we're doing. But I want you to, again, find that neutral position. So think about where your feet are. Find that comfortable position, hip width apart. Make sure that your knees are nice in a comfortable position. They're not too bent towards your bottom and they're not too far away. And again, we're going to find that neutral pelvis. So hands on your hips, bucket of water. And we're just going to do 5 rocks backwards and forwards. And just spill that water out the front, tuck the bum in. And it's really normal here to feel really tight hip flexors. That's absolutely okay. Live in that stretch for that moment as you bring your bottom forwards and then relax. And once you've done that, find that neutral again where the water isn't spewing out the front or out the back. And again, thinking about those ribs. This is where often people's ribs do flare. So thinking about gently pulling in your belly button towards the spine. You should have a small arch between your lower back and the mat where the back isn't touching, but the mid back should be lightly pressed against the mat. Good. Brilliant. And then hands by your sides, palms facing the ceiling. drawing your shoulders away from your ears and keeping that orange held between your chin and your chest. And in this position, we're just going to stretch out the neck here. So we're just going to do head turns. So looking over your left shoulder, lovely, and then looking over your right shoulder. Good. And keep going in this position. Now, if you find that you're struggling with dizziness, keep your eyes shut during this movement. That's absolutely fine. And again, thinking about pulling those shoulders lightly away from your ears to stretch out that trapezius muscle. Most of us find that we get neck tightness, neck tension. It's often where we hold a lot of our stress. So getting that really good neck stretch and rotation is just going to help loosen that off during this session. Good. Keep going for me. Feeling okay?
Mm-hmm.
Good. And then we're just going to add in head circles. So instead of looking side to side, we're now looking and then rocking up over the ceiling to the other side, chin to chest. And I just want you to do a few one way and then a few the other way. So rock, that's it, looking all the way up. And again, if you're struggling with dizziness, some people do have vertigo, do it with your eyes shut. We don't need anyone feeling dizzy or nauseous. And we're just imagining your head is almost on a ball and we're rolling a full circle with our neck. It's really good for our neck joints to make sure that we've got that full mobility, takes the pressure off the nerves, and it just relaxes your muscles down. Good. Slow and steady there, Chloe, not too quick.
Very tired.
Good. Lovely. So the next exercise is similar to what we did in standing, so we're going to try and take our arms overhead. Now for those of you that struggle, make sure we do it passively. So what I mean by that is either holding both hands or with your better arm, holding and supporting the wrist. And we're going to take our arms up overhead as far as you feel comfortable and back down. Now if this feels absolutely okay and easy to do, arms apart, reach up towards the ceiling, as far as you feel comfortable and back down. Now the beauty of doing both arms at the same time is it helps you understand what each arm is doing. Keep going for me.
So up to the ceiling, so up to there,
Yeah.
to the head.
And keep going if you can. That's it, yes. So it helps you understand what each shoulder's doing. Feel that movement as your shoulder blade runs across the mat and see if there's a difference. Are you arching with your back on one side? Are you feeling pain and pressure on one arm? And think about how we can mirror those movements. Good. And keep going. So, good. That's it. So again, drawing in that belly button and trying to make sure those ribs aren't flaring whilst we're doing the movement. We're not trying to cheat. Good. It's always tricky to do, I know. Lovely. We're going to do a few more here.
The shoulders are just crunching.
Yeah, it's perfectly normal for them to crack, pop, click. Crunching is not a problem, it's just air popping. But again, sometimes you might find one arm doesn't go as far as the other, or it tries to cheat and go around the side. Just try and correct the movement and only go to the distance that is comfortable. And if that is just to chest height, that's just to chest height for now. Good. Now we can relax our arms by our sides again, and we're going to take it up a little bit, but it just depends on how you feel. So this is called the snowman because we make snowmans in the snow. So palms facing the ceiling, and we're just going to take our arms out to the side as far as you feel that stretch in the chest, and then back down. Good. And you might find your hands can go further on one side than the other. That's absolutely fine. And back down. How are you feeling? Okay?
Yeah.
Feeling a stretch?
Yeah.
Good. And back down. Now we can take it up a notch. So for example, if we've got a yoga block, we can prop a yoga block on your mid-back, and that gives you a little bit more of a stretch because you're an extension. But for now, we'll just keep going as you are. Lovely. Now in this position, what I want you to think about is what your arms are doing. At the moment, your arms are coming off the bed a little bit. Arms, forearms, elbows, everything has contact, weight on the floor. Or glide up, so it's more passive, more of a stretch. Lovely. And back down. Feel different?
Yeah.
Good. Lovely. A few more here. Well done. One more. this exercise is now starting to relax the lower mid-back. So arms by your sides, or sorry, a bit further out to the side, just to a point that's comfortable but not pain. And we're just going to take our knees side to side, so lower towards the left or the right, and lower towards the left. That's absolutely fine. And work with the range that you've got. So initially you might not go very far.
Can we put our feet together?
Feet apart on this one. Yeah, keep the muscles active. When we put our feet together, it becomes a bit more passive, which is absolutely fine, particularly for getting up in the morning. But for today, I want both hips to be working, so feet apart. And can we slowly make our way towards the floor? Good, good. And during this movement, we're trying to feel each vertebrae of your spine rotating as we go towards the floor. Good, lovely, good, brilliant. And again, thinking about your ribs, are they starting to flare? Are we using too much of the mid-back, or is it more just that lower back that's rotating? Good, good, well done. Keep going for me. Lovely. A few more. Lovely. So next we are going to do some hip rolls or knee rolls. So you're going to bring your right leg towards your hands and then bring your left leg to join. So both up in the air, that's it, that's it. And then we're just going to bring our knees towards our chest and then back out. And almost like we're giving our knees and our hips a little hug and relaxing. It's a nice comforting position. A lot of us, whether we've had treatment for cancer or not, get back pain. And often the hips and the backs, they are very closely related. So if we can get some nice mobility, loosen things off, it's just going to help take away that stiffness and tension. Now, if you feel able, I want you to start doing some little rolls with it. So just trying to do some little circles with your knees, in and out. Do a few in one direction and then a few in the other.
Both knees together, yeah?
That's it, yeah. Good. And again, thinking about drawing a circle with your knees. Tricky?
Yeah.
Body doesn't want to draw?
No, it's more of an oval than a circle.
More of an oval than a circle. And we can make it a little bit trickier by having both your feet apart.
Yeah, we're hugging.
So both your feet apart, that's it. And then almost like we're a bit of a frog, we're going to rotate out and away and then bring them back in together. Good. That's it, lovely. There we go. And this one's quite a nice one because it starts to do a bit of an adductor stretch as well as the inner hip and the outer hip. So it does a little bit of everything, but make sure you change directions so you're not just working in one plane. Lovely, really good.
I like this one.
Yeah, it's a nice one, isn't it? It's quite relaxing and comforting. Lovely. And we can relax. Bringing our legs back down. Lovely. So now what we're going to do is make our way onto our all fours. So the way we do that when we're on the floor is we roll ourselves over onto our sides. We push onto our forearm. And then we bring ourselves onto our knees. You can use that forearm as a crutch to get onto all fours. Lovely. So again, we're just going to start off finding that neutral position. So making sure your hips are hip width, your knees are hip width apart, and your knees are also underneath your hip bones. Lovely. Think about where your arms are your hands kind of chest height and about shoulder width apart. Lovely. And in this position, we're going to do some cat-cow. Now, do let me know if anything feels uncomfortable in this position. We can change it up, either using pillows or blocks, or we can modify and get you to do it in standing or sitting. So in this position, the cat-cow, you've all heard of it, but we're going to start from the hips in this position. So again, thinking of those pelvic tilts that we did in standing on our backs, we're going to rock our hips forwards so that we're lovely arching our back, and then move through each joint of the spine that you're lengthening and pushing everything away. Now the key thing with the neck is it's not an extension movement with the neck. we're elongating. So less of a chin poke and more of a chin tuck and lengthen. That's it. And then we want to go the other way. And again, start at the hips. So rock, slowly squeeze your bum, peel one vertebrae up towards the ceiling at a time. One at a time, all the way through. Again, orange between your chin and the chest with all movements. We're not bending the neck, we're elongating that neck. Brilliant. And back the other way. Whilst you're doing this movement, think about again, what are your ribs doing? Are we starting to arch too much? Are we engaging our tummy muscles? In most Pilates movements, we should feel a light engagement, keep going for me, of your belly button drawn towards your spine. That means your deep core muscles are active and they're helping stabilise our posture. The other thing I want you to think about is, what are your shoulder blades doing through this movement? You should be feeling your shoulder blades glide, either as we're pushing the floor away from us to arch our back, or pinching towards our spine as we're going towards the floor. Lovely, and back the other way. Good, keep going. It's actually very hard when you go slow. Brilliant, lovely. Keep going. Lovely, really, really, really good. 2 more for me, and then we'll move on. Lovely, and again, thinking about that neck position. Good, good. And relax, lovely. And then lastly, in this position, we are going to do the famous child's pose. So again, all fours hip width apart. Take your hands a bit further away, walk as far as you feel comfortable but not into pain, and then using your body, keeping your back flat, we're taking our hips backwards and just going as far as you feel comfortable into a stretch. Now for some of you, you're not going to get very far because that shoulder feels tight, painful and sore. That's absolutely fine. And we're going to hold that stretch, and I want you in this position to do 5 deep breaths. So remember what we taught at the beginning. Inhale through your nose, exhale through your mouth. 5 deep breaths in this position. Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. One more, inhale and exhale. And then come forwards back into that neutral position, gentle with the hands, and then we're going to slow and steady get back into standing. So going on to one leg forwards, bringing the other legs forwards and all the way up. And we're just going to finish with a few stretches. So we're going to start off with just stretching out our hamstring. So you're going to bring your left leg forwards, straighten out that leg. Depending on if you want more of a stretch or less of a stretch, you bring your toes towards the ceiling. Back is nice and flat, wide stance so you don't feel wobbly, so maybe take your right leg out a bit wider. And we're just going to slide our hands down straight forwards and just reach forwards with your chest. So again, we're not arching our backs, we're staying tall, and I want you to feel that stretch in the hamstring. Good. And we're just going to do 5 where we come up and back into it. 1 and up and back into it. 2, 3, 4, 1 more, 5, lovely. And the same with the other leg. So wide stance, either foot flat or raise your toes towards the ceiling on the right. Lean yourself forwards, nice flat chest. 1, 2, 3, 4, and then 1 more, 5. Good. Then we're going to work on the hip flexors. So one leg forwards, wide stance, but a bigger stance than before. And then in this position, slightly bend that front knee. Keep your back leg nice and straight at the hips. And then we're going to lunge forwards with the front leg forwards. And really pull that hips forward so that we feel that stretch nice and tall with your chest. And you should feel that stretch in the hips. And then in this position, we're going to do 5, reach up towards the ceiling and back down. 1, good. 2, 3, and again, for anyone that needs, if you need a wall or a chair, let me know. 5, brilliant, and then we'll switch legs. So the same thing, right leg forwards, keep the back leg nice and straight, bend that front leg, hips forwards. Once you've got that stretch, and if you feel stable to do so, reach up for 5, 1, 2, 3, 4, last one, 5. Brilliant, and you can relax. And then the last thing we're going to do is 2 or 3 roll downs. So in this position, chin to chest, and we're just going to roll through every vertebrae in our spine, all the way through one joint, and lower down towards the floor, and go as far as you feel comfortable. Take a deep breath at the bottom, and then squeeze your bum and roll yourself up one vertebrae at a time. And like I said, we're going to do 2 or 3 of these. So nice and tall, deep breath in. Exhale, roll through each vertebrae of your spine, nice and slow. One joint at a time. You'll find the low back is stubborn, doesn't move as quickly as the others. All the way down, as far as you feel comfortable. Some of you will touch the floor, some of you won't. That's absolutely fine. When you're down there, take a nice deep breath. Exhale, squeeze your bum, and again restack that spine. One joint on top of the other. Shoulders up and back, nice and tall. Neck nice and long. Orange between your chin and your chest. Last one, deep breath in. Exhale, chin to chest. Moving through the upper back, middle back, lower back. Slow and steady, one joint at a time. Nice and loose through the knees. Lovely, really, really good. Once you're at the bottom, deep breath in. Exhale, squeeze your bum. Roll one vertebrae on top of the other through your lower, your mid, your upper back. Nice and tall. Correct your posture, everything's nice and neutral. And we're done. Thank you. Hopefully you've had a good session. Anything challenging?
Vertebrae.
The vertebrae, moving through one joint.
One to go through right for a bit, and then it's just like 3 at a time.
Yeah, it's always really tricky, and these things, it's going to take time. Again, you're not long after your treatment, so just remember that there will be certain movements that you're really good at, certain movements you're not very good at. There will be days where you're more mobile than others, and that's absolutely fine. The key thing with everything is little and often. If you want to take any of these exercises to at home, please do, but don't push into pain. A bit of discomfort, a bit of a stretch, but the little and often is what's going to get that movement improved. You can't bully it into getting better.
Yeah.
Okay. Thank you very much, everyone.
Bravo.